My name is Lynn Carmichael. I'm the Senior Director of Computational Bioinformatics, which basically means me and my group are responsible for setting up the statistical validation for clinical tests and clinical screens that we're implementing at Sanford Imaginetics. So Sanford Health is a large healthcare provider that operates in the upper Midwest and Plains between Minnesota and Montana. We serve about 2 million patients and customers across over 130 communities. Sanford Imaginetics was started to bring genetic medicine to these populations. Genetic medicine is important to provide customized treatments for patients based on their own circumstances, their own genetic background, rather than a one-size-fits-all sort of treatment. It's also important from the standpoint of precision prevention, where we can detect potential risks and problems a patient might have before they actually have any symptoms. And that's really the critical thing that we're working on now. One of the large challenges we have in terms of analyzing the large amounts of data at the scale that we need to be able to operate in some ways, it has less to do with the logic of the analysis or the data science itself, and more to do with some of the operational aspects and the difficulties of turning this into an actual clinical screen versus a research project. So we have a lot of skilled data scientists and bioinformatics experts. We don't have a whole lot of software engineers and DevOps experts. And so finding a platform where we can produce reproducible analysis of the data that we need to look at and provide documentation and versioning and testing and deployment without us having to spend months or potentially years setting that up ourselves has been a big advantage. The unified data analytics platform on Databricks, it gives us one place where we can define the statistical and genetic analysis that we need to do to validate and implement the clinical screens that we're working on. And in the same platform, provide the documentation that's necessary for clinical validation and certification for the tests, and a seamless and easy way to transfer that into an operational platform with testing and version control, and at the same time maintain the data integrity required for HIPAA compliance. The most exciting direction that I think we're going is incorporating larger amounts of information about our patients into providing better preventative care for them and better diagnostics and better precision medicine. The Databricks platform allows us to take clinical research and development and turn it into a clinically validated screen or test in far less time, which allows us to save a lot of the money and effort it would generally require to do this on our own on-premises computational platforms.